All right, let's talk about something every tax pro has to deal with. That really tricky line between what's a medically necessary procedure and what's just cosmetic surgery. One is deductible, the other's not. It sounds simple, right? But oh boy, the reality is a tangled mess of laws and court cases that have been building up for decades. So let's jump right in and untangle this. So where does all this confusion come from? Well, it's actually baked right into the tax code itself. It's like this constant tug of war between two big rules. You've got IRC Section 213 over here saying, hey, you can deduct your medical expenses. But then you have Section 262 on the other side pulling back hard and saying, nope, no deductions for personal stuff. This clash, this statutory tension, that's the battleground. Every single one of these cases is fought right there in the middle. Okay, so to make sense of all this, we're going to break it down. Here's our game plan. First, we'll look at that core conflict in the code. Then we'll dig into the official definition of medical care. After that, we'll tackle the big one, the cosmetic surgery exclusion. Then we'll explore the two main ways a procedure can still be deductible. And finally, we'll get into what's probably the most important piece for you as a practitioner, why having the right paperwork is everything. All right, first up, the code's core conflict. We're talking about where medical necessity bumps right up against personal spending. At its heart, the medical expense deduction is really all about fairness. It's this idea called horizontal equity. Think about it this way. Say you've got two people, both making $100,000 a year. One of them gets hit with $30,000 in unexpected medical bills. The other doesn't. Should they pay the same amount in taxes? Of course not. The person with the medical bills just has less ability to pay. That's the whole point. But, and this is a big but, that idea of fairness runs smack into one of the most fundamental rules of tax. You can't deduct your personal spending. So the system is forced to draw a really, really sharp line between a medical need and a personal want. Okay, so that brings us to the big question. What exactly is medical care in the eyes of the IRS? To get to the bottom of that, we have to go straight to the source, right? We've got to look at the exact wording in the law, which is IRC Section 213D1. And this is where things start to get really interesting. See, the definition in the code is split into two parts. The first part is pretty much what you'd expect. Amounts paid for, diagnosis, cure, mitigation, treatment, or prevention of disease. Makes sense. But then there's this second part, this much broader language that says, or for the purpose of affecting any structure or function of the body. Whoa, that second piece, that's the one that opened up a huge can of worms and led to decades of debate. And if you want proof of how wide that door was swung open, get this. Before 1990, the IRS itself issued a ruling, Revenue Ruling 76342, that said a facelift was a deductible medical expense. A facelift? Can you believe it? And their logic was simple. Hey, it affects the structure of the body, right? Your skin. Back then, you didn't have to prove you were treating a disease. That was enough. Well, as you can imagine, that didn't sit well with Congress for long. They looked at this and saw a massive loophole. People were basically deducting personal cosmetic procedures, so in 1990, they decided to step in and shut it down. They enacted Section 213D9 specifically to close this loophole for good. And that new rule, IRC Section 213D9, is what we now call the cosmetic surgery exclusion. It's like Congress built this big, strong firewall into the tax code. It's one job: to block deductions for any procedure that's really just about improving how someone looks. The law gets super specific here. It defines non-deductible cosmetic surgery as any procedure that's geared toward improving your appearance. Unless, and this is the most important part, unless it also does something else. It has to meaningfully promote the proper function of the body, or it has to prevent or treat an illness. This was a total game changer. Suddenly, just affecting a structure wasn't good enough. You had to prove there was a real medical reason behind it. So this gives us a really clear two-step test to apply. Step 1, ask yourself, is the main point of this procedure to improve the patient's appearance? If the answer is yes, then right off the bat, we assume it's non-deductible. The burden of proof then totally flips over to the taxpayer. It's on them to get over the hurdle of step 2, proving that it also has a real medical purpose, like helping the body function better or treating a disease. If they can't prove that, sorry, no deduction. But listen, even if a procedure does improve someone's appearance, it's not automatically a lost cause. The law itself actually gives us two specific escape hatches, two pathways to still get that deduction. So path number one is that functional/treatment test we were just talking about. Basically, you get the deduction if the procedure passes that second step of the analysis. A perfect example the IRS gives us is laser eye surgery. I mean, sure, not wearing glasses might improve your appearance, but that's not the point, right? The real reason you get it is to treat myopia, which is a medical condition, a dysfunction of the eye. It's about restoring proper function. Okay, path number two is what we call the Amelioration Test. This one is for procedures that fix a deformity, but it's very specific. The deformity has to be the result of one of three things: a congenital abnormality, so something you were born with, a personal injury from some kind of trauma, or a disfiguring disease. The most classic example here, and a really important one, is breast reconstruction after a mastectomy. That's not cosmetic, that's correcting a deformity caused by treating a disease. So let's look at how this plays out in the real world. We've got breast reconstruction and laser eye surgery. Deductible. We've got teeth whitening. Not deductible because it's purely for looks. But then look at this last one. Post-bariatric skin removal from the Almeriti case. This is a huge one. The court said, yes, this is deductible. Why? Not because it made the person look better, but because it was medically necessary to treat the diseases that came from the excess skin, like awful chronic infections. It treated a complication of the disease of obesity. Okay, this brings us to what might be the most critical part of this whole discussion for you, the practitioner. Because knowing all these rules is great, but if you can't prove your case to an auditor, it's all for nothing. When it comes to this stuff, substantiation isn't just a good idea, it's the whole ballgame. Remember that big rule from Section 262 that says personal expenses are a no-go? To get past that, you have to meet what the courts call the but-for test. It's simple in theory, but tough in practice. You have to be able to prove that the expense would not have happened but for the medical condition. In other words, the medical problem was the only reason for the procedure. It's a high bar for sure. So what does that proof actually look like in a client's file? Well, you've got to build a fortress of documentation. We're talking about medical records that spell out the physical problems, things like chronic rashes, infections, pain, not just, I don't like how this looks. It's also super helpful to show that you tried other things first, less invasive treatments that didn't work. And of course, you need a doctor's official diagnosis of a specific disease or deformity, and a letter that draws a straight line connecting that diagnosis to this specific procedure. And the absolute cornerstone of that fortress, the MVP of your client's file, is the letter of medical necessity, the LMN. And please, this is not just a quick scribble on a prescription pad. This needs to be a detailed, formal letter from the doctor, and you want to get it before you file a return. It has to clearly state the medical condition, explain exactly why this treatment is necessary, and describe how it's going to fix or help the problem. I'm telling you, without a strong LMN, trying to defend this deduction in an audit is an uphill battle. So I'll leave you with this. The next time a client comes to you with one of these expenses, the question isn't just, is this deductible? The real question you need to ask yourself is my client's file audit-proof? Is the substantiation we have so solid that it can withstand the toughest scrutiny from the IRS? Because when it comes down to it, that's the only question that truly matters.